The National Association of Seadogs don show face to support one rural community for Federal Capital Territory with better healthcare. The group wey pipo sabi as Pirate Confraternity do one free medical outreach for Kukwaba village wey dey under Buhari Area Council. Na two chapters of this association, Zuma Dec and Sahara Dec, organize this outreach. Over 200 people for the community collect medical help, including blood pressure and sugar level check, lab test, and general doctor consultation. The organizers yarn say the outreach dey necessary and urgent, especially as Kukwaba no get any government hospital wey dey near them, as the nearest hospital dey about 18 kilometers away. The outreach also happen same time as dem dey celebrate two big milestones, one wey be Professor Wole Soyinka, wey be one of the founding members of the group wey just clock 91 years, and Dr. Joseph Oteri, nurse Capon, wey don do 40 years for medical service and dey always push for healthcare wey everybody fit reach. Dr. Oteri, wey start im medical work since 1985, talk say this outreach na part of wetin the group don dey do since, wey be to serve communities wey government dey forget. E still remind people say NAS start dem medical waka about 30 years ago for Rivers State, and since then dem don dey do outreach everywhere for Naija. E talk say the group dey try do something wey go last and dey check wetin each community really need, find drugs and gather volunteer teams wey include doctors, nurses and health workers.
NAS on its own have been doing a lot of medical outreaches. 1996, I did an outreach in Rivers State, right, while I was still in Port Harcourt. And after that, we'll be doing outreaches at every quarter when we go for our quarterly meetings. So this is just to show that since you were in charge of all those outreaches, let us celebrate you with an outreach. So this is what we've done. Most times, what we do, we support the downtrodden, right? People that couldn't afford some things are the ones we actually target. So if you look at most of these people here, some of them might not even have access to paracetamol if they go to a clinic. So we felt, okay, let us bring all the things they need. Normally, they start with the scoping mission where they find out what are the prevalent ailments in the community. Then they procure drugs to take care of those ailments. So they have a lot of human resources, doctors, nurses, and volunteers, plus laboratory people. So that's why they're all here doing this work together.
Victor Chukwuemeka, medical officer for Zuma Dec, talk say the situation for Kukwaba no good at all, and government suppose act sharp. The group still talk say they get plan to expand the outreach next time to cover eye check, pregnant women care, and treatment for disease wey dey last long. NAS leaders say dem don dey talk with Federal Ministry of Health to put one better primary health center wey go dey not more than 2 kilometers from Kukwaba.
We're going to come back here on a later date based off what we've seen today. Because this is just asking them to come for the basic checks, the basic medications, treating malaria, the sepsis, the basic things you see in an outpatient clinic. That's what we're doing here today. Off of what we're doing today, we'll go from there. Follow-ups on other specialties, we'll invite them to come. About capacity, this is NAS. What we're doing here is, our central body is aware we're doing it. We have the capacity to even go beyond the numbers, if need be. Yes. For a start, we're attending to the basics. Free medical checks that would help us indicate whether you're hypertensive, diabetic, the C-class that don't even know their status. They're always in the hospital. We have two cases that we've identified this morning that are C-class. They're always in their local hospitals. They give them markings and all that without knowing that these guys are actually C-class. We're also offering our lab interventions that will help us detect all these things. The basic investigations, the lab, the full blood count, hepatitis panel, HIV panel, all of those, so that you know where you are, so that we can go from there. Then we've also done a scoping on the follow-up to come back in this community for the ophthalmology intervention.
Obinna Odunze, area mate with Area 9 Command, talk say giving back to society na the main reason why dem dey do all this. He say he hope say this kind outreach go make people invest more for rural healthcare.
We organize this outreach to honor both of them. We think that as a social advocacy organization, the best way to honor them is to come to the less privileged, the underserved, to make sure that we also offer some help to them. So essentially, we decided to come to Kukwaba village in Kubuahia to do this medical outreach.
Some Kukwaba people wey talk during the event share emotional stories. Some talk say people don die from common sickness like high blood pressure wey dem no fit treat. Others talk say some women dey born for house because hospital far.
1 year plus now. If I'm sick, I do go to like all those big pharmacies from Dibia. If the sickness is much, I'll go to all this private hospital. So the general hospital is far from this place, very, very far. Some of them that they don't have a private, that they cannot go to private, they don't even have money. You know, sometimes they do go to pharmacy and just get, you can see that what they are sick for, they're supposed to spend like maybe 40,000, 50,000. Due to say they don't have money, there's no primary health care here, they will just go and afford something of like maybe 5,000, 3,000 to just take good care of themselves.
The National Association of Seadogs say them go continue to fight for better healthcare and support grassroots people, especially where help no dey. Make una no forget say, as we see am, na so we dey talk am. We no dey take blame. Ohifemi Onosimo, TMC News.